Today our class is about median nerve. Before starting the class, please share the video with your friends and classmates and do subscribe. Follow us in Instagram for notes. Today our class is about median nerve. Important concept for 5 marks as well as sometimes in case of essay answer also. Okay, now coming to the median nerve, see the first root value of median nerve. See the median nerve, we already discussed about it in the brachial flexus. The root value of median nerve is from C5 to C5, C6, C7, C8 and T1. From C5 to T1. In that C5 to T1, this is the root value of median nerve. And now coming to the course, COURS, course of median nerve. And in the course, the median nerve occupies the axilla, arm, cubital fossa, forearm as well as palm. Axilla, arm, cubital fossa, forearm as well as palm. We are going to discuss about these 5 parts in the course. Okay. Now coming to the axilla. So the median nerve in the axilla, the median nerve is divided into 2 parts. One is lateral root of lateral cord, one is medial root of medial cord. So in that, in the lateral cord, C5, C6 and C7 involved in the lateral root of lateral cord, and now coming to the medial root of median cord, C8 and T1. These segments are separated into lateral cord and as well as in the medial cord. Okay, this is the of brachial flexus, and the medial root crosses axillary artery. See here there will be axillary artery, and this medial root crosses the axillary artery to join the lateral root. This is the lateral root, right? This median root crosses the axillary artery to join this lateral root. It runs lateral side of the axillary artery. This is the axillary artery and it runs towards lateral. This is the lateral side, this is the medial side. Lateral side means away from the body and medial side means towards the body. Okay. Next, this is about the axilla, and now coming to the arm, the course in arm. Now coming to the arm. See, I will draw it here again with the arm. Now coming to the arm, the median nerve continues to run on lateral side. See, this is axillary artery. The median nerve continues to run towards the lateral side of brachial artery, because here the axillary artery is continued with the brachial artery. At the arm, the axillary artery continues with brachial artery, and this median nerve accompanies with the brachial artery from lateral side. And at the middle of the arm, it crosses in front of the artery and passes anterior to the elbow joint. This is the brachial artery. This is the brachial artery. At the middle of the arm, okay, it crosses the artery and enters into the medial side of the brachial artery, and it enters into the elbow joint. This is the elbow joint. It enters into the elbow joint. Okay, this is at the point of arm. Next, coming to the point of cubital fossa. At cubital fossa, median nerve lies most medial in the cubital fossa. See, at the middle of the arm, it is coming into the medial side, and in the cubital fossa, it is most medial. We have studied while studying about the cubital fossa in the before class. There will be radial nerve, and here there will be median nerve. Median nerve at the very medial to the cubital fossa. And now coming to this point, in the cubital fossa, it is most medial in the cubital fossa, and in the cubital fossa, it gives 3 branches to flexor muscles of forearm. Okay, in the cubital fossa, it gives 3 branches to flexor muscles of a forearm. Okay, next, it leaves the fossa by passing between 2 heads of pronator teres, and there will be here 2 pronator teres, long head and short head, and it passes in between these 2 heads of pronator teres into the forearm. In the cubital fossa, it gives 3 branches and it passes two heads of pronator teres. Next, coming to the forearm, of median at median nerve. In the forearm, the median nerve enters forearm and lies in center of arm. See, in median nerve, and it is the forearm. It lies in the center of forearm, and it lies deep to the fibrous arch of flexor digitorum superficialis on the flexor digitorum profundus. See, here there will be flexor digitorum superficialis, and it lies deep to the flexor digitorum superficialis on the flexor digitorum profundus. And flexor digitorum is superficialis and flexor digitorum profundus is deep. Okay, I will tell you here. And this is the flexor digitorum profundus. It is deep, and here is the flexor digitorum superficialis. It is at a superficial region. It is present in between here from superficial, flexor digitorum superficialis and flexor digitorum profundus. Next, at last it plays deep and lateral to palmaris longus. At last it moves here and it places at the deep and lateral to the palmaris longus. Next, coming to the flexor retinaculum. And in the flexor retinaculum, this median nerve lies deep to the flexor retinaculum. That means here is the flexor retinaculum. This part is the flexor retinaculum, and it presents at a deep to this flexor retinaculum. Next, coming to the palmar region. Here is the palm region, and in the median nerve lies medial to the muscle of thenar eminence, and it present medial like this to the muscle of thenar eminence. It also gives cutaneous branches to lateral digits and their nails beds, including skin of distals on their dorsal aspect. Okay, in the palm it moves towards the medial side of the palm. Next, coming to the relations of this median nerve, and now coming to the relations in arm. Now coming to the arm, it divides into three parts. Upper part, it is lateral to the artery, and at the middle part it is anterior to the brachial artery, and at the lower part it is medial to the brachial artery. See, in the arm it moves from lateral to the medial. So it is upper part at lateral, medial part at anterior region, and lower part at medial region of brachial artery. Next, coming to the cubital fossa. In the cubital fossa, it lies medial to the brachial artery. Next, coming to the forearm. See, it enters forearm by passing between two heads of pronator teres. We have already studied about this while studying about the course. It moves to in between the two heads of pronator teres. It passes beneath the fibers of arches of flexor digitorum superficialis and runs deep to the flexor digitorum profundus. At the lower end of forearm, at flexor retinaculum, it becomes superficialis. At the flexor retinaculum region, it becomes, here in this region, it becomes superficialis and lies between the tendon of flexor carpi radialis. It is present at lateral side, and in between, it becomes superficialis and lies in between the tendons of flexor carpi radialis. It is at lateral side, and flexor digitorum superficialis, it is at medial side. The median nerve lies in between these two muscles. Next, coming to the wrist. It lies deep to the flexor retinaculum. This is about the relationships. And now coming to the branches. See, it has, I explained clearly in the notes about the branches. Branches are very clear in the notes. So in the branches we have muscular branches, next cutaneous branch, next articular branch, next vascular branch. So we have four branches. In the four branches, and each branch supplies at each branch is divided in. See, while studying about this median nerve placed at axillary region, arm region, cubital fossa, forearm region, as well as palmar region. Each branch includes each and every part of the median nerve where it occupies. Okay, so it is clear, the branches is clearly explained in the notes. Follow us in Instagram for notes, the link is given in description. And next, coming to the clinical anatomy, see if the medial branch, if the medial branch is, if the medial nerve is injured, it causes weak flexion of wrist. See, there may be weak flexion of wrist, we cannot flex the wrist completely, and there is loss of pronation like this. We cannot pronate the our forearm at the region of forearm. Next, loss of flexion of proximal interphalangeal and distal interphalangeal joints, and loss of flexion of interphalangeal joints of thumb, and loss of thenar eminence, and sensory tropic and vasomotor changes. There is change in sensory, tropic and vasomotor changes. I already told about tropic while studying about in the cubital fossa. What is tropic in the cubital fossa? So have a check on that. It losses, there may be loss in sensory, tropic as well as in the vasomotor changes. This is all about the clinical anatomy. This is all about the median nerve. We will meet again tomorrow. Thank you all.